And these PMSs that we get, it's also a sign of hormonal imbalance. And it doesn't mean that you absolutely have to go on birth control pills. Birth control pill is quick fix. I'm OBGYN. I prescribe birth control pills. I'm not against them. It's just not the first choice.
Right, right, exactly. And I believe that it has been overprescribed, right? So you have acne, here is the birth control. And effectively, as you say, the body is so nature and our bodies are so intelligent. So if they perceive that we're adding hormones, they're going to start not producing so much hormones, right? So this is again, a very, very important message. It's a quick fix. It's a Band-Aid in a way, right? So,
and it also creates this negative loop, like you said. It
right.
stops your production of hormones, correct?
Exactly. And I read a relatively recent study from 2019 about the effects of birth control in your pituitary glands and the effects of inflammation there, which is mind-blowing to me, right? That just the birth control can do something like that. So it's really important, and that's why we're so well connected, Dr. Shahnoz, is because effectively of science, medication specifically is a great way to help us, but sometimes it's not the first option to take. So I love that message, and that's the reason why we created hormone-free products to help support that stimulation of progesterone and estrogen and testosterone. So I'm glad you're mentioning that.
Yes, yes. And also PMS, for example, like speaking of natural things, PMS almost became a normal thing. Like if you have PMS, that's considered normal. But PMS is the language that your body is trying to tell you what's missing in your body. If you really listen to it, what kind of cravings you have. You're having cravings for certain foods. That means it's not that you have to eat that particular food. It's the element in that food that your body is craving for. Or
Right.
if you're craving for a specific like savory foods, that means it could be your adrenals. So you need to support your adrenals again with the natural ways. So understanding your body, it's very, very important. And this is what we're trying to do in New York, which is coming up this June on the 18th, where we're going to be talking about how to activate your natural resources in your body. So you could not only balance your hormones, because your vitality is not just hormones. Your vitality is your hormone, glutathione. How to produce your own NAD, how to produce your own glutathione. You see, we'll talk about your genetics. We'll explain everything. We basically will take you under the hood of your body and say, you see this engine, you see this, you see that, that's how it works. So it will make you education, not only educational, but it also will be, you will be educated consumer, meaning that you're not going to be just jumping on any cream or any vitamin or anything. You will have some knowledge. You will have this precision.
Right.
Instead of just blindfolded saying, I'll take my vitamins, I take care of myself. Are you really taking the right vitamins? Are you really taking or eating food according to your genetics? It's a much deeper conversation that needs to take place. And, even hormones, like when we talk about, not hormones, but let's say you take your magnesium, you're already stimulating your estrogen production. You're helping with progesterone, right? And you're taking your vitamin D, same thing. You're providing building material for your estrogen and testosterone and progesterone, correct? But besides that, what you do also by taking these vitamins go exactly on the specific genes and open it up. For example, my patient asks me, which magnesium is the best? It depends on your genetics. For some people, you must be on biglycinates. And for some people, you could be okay on other types of magnesium.
Right. That's so interesting.